This is Jefferson Close-Up, and I'm Carol Celine. My guest today is Dr. John Abraham. Welcome.
Thanks.
You grew up in Staten Island, but you went to high school in New York City, which was quite a commute for you. Why did you do that?
I had the opportunity to go to Stuyvesant High School, which is in Manhattan. I grew up in Staten Island, and you're right, it was about an hour and a half or almost 2 hour commute each way.
Oh, my.
But Stuyvesant High School is a well-known, it's what we call a magnet school for math and science, and it was a real opportunity to be able to go there because it helped sort of develop my interest in sciences and things like that.
So that's one thing about you that a lot of people don't know. Is there anything else?
There are a lot of things I like to do outside of medicine. I really like old houses, and so I've done several projects in terms of renovating old houses, and that's some kind of a passion of mine. I'm also a mountain biker, so I like to do a lot of mountain biking and cycling in general, but more my passion is more toward mountain biking than road cycling. So those are some of the things I enjoy doing.
And I think you told me you climb mountains?
That's right. I started out sort of as a young kid. My family would go on camping trips, and those were sort of our routine vacations. We'd go camping, and as I got able to do it myself, I started going to first hiking, and then it was sort of like small mountain climbs, and then it became bigger mountain climbs, and so now it's sort of I do a fair amount of mountaineering, I guess is what it's called.
Now, in addition to all these things, you also have a rather unusual specialty. You are an orthopedist, but one of 200 orthopedists in the country who specialize in cancer, in oncology.
That's right.
So you don't fix broken bones, but you deal with bone cancers. Tell us about your specialty.
Well, just like you say, orthopedic oncology is a relatively rare specialty. And the reason for that is because bone cancer is much more rare than other types of cancer. And actually, the specialty is not just bone cancer, it's bone and soft tissue cancers. And those fall into the category of sarcoma. So you're right, there's probably about 200 or so that practice this kind of surgery with any high volume. And that's in the U.S. and in the world. It's the world population is not that much bigger. There's not too many doctors that deal with this kind of thing.
So why did you go from when you studied orthopedics into oncology?
One of the things I really found that I liked about oncology is that you develop long-term relationships with patients. If I do a resection surgery on a patient with a bone cancer, I may see that patient for 5 or 10 years in follow-up. So that is probably the aspect of oncology within orthopedics that really appealed to me. I like being able to follow my patients. I like seeing them over long periods of time. I like to have a patient come in 10 years later and still remember who I am and remember the day that we did surgery and remove their tumor and those kind of things.
So patient relationships are very important to you.
That's right. They are.
Yeah.
They are. The ability to come here to Rothman and Jefferson and put together this sarcoma management team has really been a phenomenal experience. I think when patients know that they have that kind of contact with their doctor, the availability, and they know there's a whole team supporting them, it helps reduce some of that anxiety that can surround all these things.
That must be very gratifying.
It is nice. It's nice to know, and I know, it's not just me, it's the whole team and everything we're able to offer. I'm proud to say that we can really, anything that anybody in the world can offer for sarcoma, we can offer right here, and so that's nice for us to be able to tell patients. So that's very satisfying to be able to say.
How reassuring. Thanks for coming in.
Oh, you're very welcome. Thank you.